Global health experts are tracking the spread of a new COVID-19 variant. It's called EG5, and so far cases have been reported in the U.S. and the U.K. For more on what
uptick in COVID-19 cases across Chicago. Chicago Tribune reporting lab confirmed cases up 27% at the end of July. That's around 67 new cases per day. But doctors say this latest spike isn't likely to turn into a surge. Statewide, Illinois officials are reporting its lowest number of COVID deaths since the start of the pandemic. This comes
more on what we need to know. I'm joined by infectious disease specialist Dr. Isaac Bogach. Doctor, good morning. Good to see you.
Good morning, Marcia.
So just when we were all hoping that COVID was in the rear-view mirror, we now have a new strain that is dominating, and it's been detected in the U.S. and the U.K. What does it tell you about the spread of COVID-19 and the development of new strains?
Yeah, it's a great point in that COVID really never went away. Obviously, we're not seeing the same scenes that we saw earlier in the pandemic, like in 2020 and 2021, where our healthcare system was completely overwhelmed. But it never, of course, went away. It's been around and it's been waxing and waning since it was introduced to Canada, and really since the spring of 2022. We've certainly seen waves. They just haven't been as impactful as earlier waves. EG5 is yet another mutation. It's still under that Omicron umbrella, and I don't think people will notice anything different compared to more recent waves that we've seen since the spring of 2022. The diagnostics are the same. The therapeutics are the same. The symptoms are likely very similar. The ways to prevent it are the same. We have the tools to do this. We'll likely see a rise in cases starting, in the latter part of August or early in the fall in September. And certainly we have detected this EG5 here in Canada. It's been detected in Ontario for several weeks now, and we'll probably see more of it in the weeks ahead.
So you mentioned the tools that we have in our toolbox. I think it is pretty safe to say a lot of people have not been keeping up with their COVID-19 vaccines. To that, what do you say? What's your advice to people as we go into the fall and we now have a new strain of the virus, Doctor?
Yeah, this virus is going to continue to impact Canadians, and of course it's going to disproportionately impact those who are more vulnerable to the virus. Those are older Canadians, and those are people with underlying medical conditions that put them at greater risk. The National Advisory Committee on Immunizations a few weeks ago made an announcement. They basically said, listen, we'll see a rise in cases in the fall. There's going to be an updated vaccine available. It's a booster campaign in the fall. They recommend that people go out and get this vaccine, but they were very clear to strongly recommend that those who are older or at greater risk for infection or who reside in long-term care facilities, a few other groups as well, that those individuals go out and get the vaccine. We know the vaccine, of course, doesn't do the same as it used to in terms of protecting us against infection and onward transmission. It still does to a little bit, but not to the same degree. But the vaccines continue to provide significant protection against more severe manifestations of the virus, like hospitalizations and death. And we can expect the vaccine to continue to provide that same level of protection, especially for the most vulnerable Canadians.
What have we learned about how long a vaccine causes immunity, gives us immunity?
Well, we can think of this in a few different ways. One is, does it stop infection? And certain vaccines do that. For example, measles vaccines are extremely effective, and they do a remarkable job in blocking the vast majority of measles infections. COVID-19 vaccines initially blocked infections rather well. And of course, if you block infection, you block onward transmission. But with the mutations of the virus, we don't see the same degree of protection in terms of blocking infection and onward transmission. It still can do it. It's just not nearly to the same extent. But regardless, the other way to look at this is, hey, does this vaccine protect me from severe illness? And can this blunt the severity of infection and the severity of illness that someone's going to have, especially people who are vulnerable to COVID or more vulnerable to severe infection or more at risk for severe infection? And the answer is yes. This vaccine does a remarkable job in protecting the most vulnerable from landing in hospital. And I think it's important. It's not perfect, but it does a really good job. And I think it's extremely important that Canadians who are, especially those at greatest risk for severe infection, be up to date on their vaccines. And we'll hear more from NACI with the fall vaccine booster campaign in the coming weeks.
Dr. Bogach, thank you so much. Dr. Isaac Bogach is an infectious disease